I'm very pleased to welcome the moderator for this final session, Ms. Silvia PEREL-LEVIN, Vice Chair of the NGO Committee on Aging, Geneva. She has been working extensively on the issues of civil society advocacy and she is committed to older persons' rights. I think she's perfect guide for our discussion on transforming awareness into concrete actions. So let's put our big hands together to give a warm welcome.
So this will be the session from awareness to action, strategies from combating ageism. And we will build on the insights from the previous sessions and focus on what really we can do and what is being done. And I will not talk too much. We have three very good speakers and two very good discussants. We have Dr. Kai Lechsenring, and he will be our first speaker, Executive Director for the European Center for Social Welfare Policy and Research in Vienna. Then we have Dr. Adnike Novasigiro, Commissioner Indonesia National Commission on Human Rights. And then we will listen to Dr. Somsak Aksilp, Executive Director, ASEAN Center for Active Aging and Innovation. And I will introduce the discussants afterwards. Thank you. So I will call on our first speaker, Kai Lechsenring. Actually, I should be able to pronounce your name better, Kai. We've known for many years. He is the Executive Director of the European Center for Social Welfare Policy and Research, and his background is in political science, social policy from the University of Vienna, and organizational development consultancy. I'm looking forward to listening to you. Kai, the floor is yours.
Thank you, Silvia. No problem with the pronunciation. It's even difficult for Germans. So can you see my screen? It's all fine?
Yes, carry on.
Yeah. Okay. Thank you. So yes, we have heard a lot about ageism and that it exists and that it even becomes more important, and that there is a need to raise awareness. Now this session is about how to deal with it, and how can we change our societies also towards combating age discrimination. And my talk will be about changing institutional frameworks, and also based on my background as director of the European Center for Social Welfare Policy and Research, how to change the institutional framework of welfare states to combat ageism. Because usually if we talk about aging, we often hear that there is a demographic time bomb, there are rising dependency rates, we have unsustainable public expenditure on aging, pensions, healthcare, long-term care. We have too low fertility rates, and allegedly there is a lower productivity of the graying workforce. And so what we need to do is to protect older persons. At best, this is what we hear, while we should talk much more about the opportunities of new individual and societal choices in the ongoing transformations of work. We are talking about Work 4.0, and I will talk about Aging 4.0, that needs to be developed to underpin these transformations in terms of technologies, in terms of new types of health and social care organization and care work as such, And so therefore we need new types of social protection and inclusion. Our welfare states are, at least I'm talking here from a European perspective, they are also in pensionable age. So perhaps there will reforms will be needed and are ongoing, but I will discuss also whether those reforms that have been done until now are useful, in particular to combat ageism. And therefore, I will propose new patterns of work, care, learning, partnership, and leisure across the life course, independent of chronological age. We heard already that chronological age discrimination is, or ageism is often built into existing rules and ideas. And talking about existing rules and ideas, we have still this old pattern or this idea of the life course. What is a life course? Well, we have education in the beginning, then we work in our middle age, and then we have leisure in pension age. But actually, activities nowadays cannot really be assigned to defined age brackets, or should not. If all these activities and the famous gerontologists Riley and Riley proposed this 25 years ago to have a more integrated life course, but doing everything simultaneously is, of course, creating rush hours of life, as some colleagues called it, and excessive demands on the individual. You should do education, lifelong learning over your life course. You should work and you should you should have also some leisure over the life course. And what the Rileys did not mention so much was care work that is also, and unpaid work that is also there and contributes to creating these rush hours of life. So we need to break down structural age barriers and look for new possibilities for old and young people to meet over the life course. So we have seen a continuous disintegration of the traditional life course patterns, but still in our heads we have that education. But here you see we have more and longer education. We have difficulties of younger people to transit from education to work. Within the work life, we have technological change, unemployed periods, care periods, other leaves from employment, and we have to combine this also with unpaid work. And then in pension, also there we see rising life expectancy. I mentioned welfare states and, for example, pension systems were introduced in Europe mainly after the Second World War. There was a pension age fixed, but at that time life expectancy was much lower. So now we have the pension period also in our heads, that this is something where we are working towards. Or many people are working towards it, and then, but then there are care needs. You need to provide informal care during your pension age, probably to your partner, to other family members, and you're also asked to do volunteering. So this is continuously changing, and at the same time, we now are solicited to also have lifelong learning. But here we see, so these were the first reactions of policies also, But here we see the social selectivity of basic and further education systems. Mainly those are in lifelong learning who are already well educated. And so this is creating inequalities. We are also asked for active, so there are also policies for active and healthy aging, of course, but they are mainly focusing on extending working lives, but still with unequal chances and inequities due to these cumulated disadvantages over the life course, often due to the original or basic education you had. There are even some concepts about talking about successful aging, and then this becomes a normative approach where, well, you have to age successfully, but what about if you are in need of long-term care? What is happening then? And here we face huge problems with the reconciliation of work and family life, often on the shoulders of women who are providing care work within the family. The background of this is, of course, that we often see paid work as the unique means for social inclusion. Here, one thing I mentioned already, unpaid work is the kind of lucky finding of capitalism. Without this, many other or a large share of paid work would just not be possible. It's still based on the single male breadwinner model. So we see a gender care gap, a pay gap, and a pension gap as a result of all this. And we ask ourselves more and more why or who or for which reason somebody defined 60, 65, or now 67 as the pension age. There is no real empirical idea behind it. And when the pension systems were introduced, well, this was perhaps, and in many countries it is still, that you then have perhaps 4 or 5 more years of life expectancy. And now this might be in some systems up to 30 or even 40 years of pension time. So we see that something needs to change. Just to show you that life expectancy, again, in the 60s was around 66. This was worldwide. Today it's around 80. And so you see that with a legal pension age of 65, this extends. And in 2060, it is supposed that this will increase to 84. And the question is what we are doing with all this additional time in our life, or perhaps what we could think about, how to spread this more, so this gained longevity and life expectancy, how to spread this perhaps over the lifetime. And then we can remove things like this pension age, because then people can decide at several times when to take time off, because they have other things to do, for example, care work, or they need a second education due to technological change. An original education of 30 years ago in IT, for example, if you don't continue to work on this, it doesn't work. So what you need is time for care, for unpaid, until now unpaid work, for retraining, for upskilling. And this would be also second and third chances for many people who are now or often decide about their life course when they decide what type of school to go to at 11, 14, or even earlier. So The idea is to facilitate new trajectories and new types of transitions over the life course between paid and unpaid work, between education and training, and paid work, between family obligations and work or leisure. So this means you need incentives for retraining, for upgrading, and also for care leaves for both men and women. So this could also be thought in terms of rights and obligations. So if you have, for example, a further education account, but at the same time, some guaranteed income during these until now unpaid leaves. This would also create a new intra and intergenerational equity, and the chronological age as such would not be that important anymore as before, as Lucy mentioned before. If you have regulations in your legal framework that are forbidding you something to do at from a certain age onwards, or force you to do something at a certain age, this will create inequalities and inequities, and we need to prevent and enable intervention and find enabling interventions over the life course that combat these inequalities and therefore also age discrimination. This means, for example, education guarantees for adolescents, but also these are things that are already there, but often also then again linked to a certain chronological age. So introducing educational leaves, for example, or other initiatives of lifelong learning are existing, but we need to spread them and enable people to really use them over the life course. As I mentioned already, this calls for a new type of welfare state because...
sorry, Kai, you have to start to wrap up, please.
Yeah, I will just two arguments that we need a new welfare state that goes away from the chronological age and addresses the new risks and new trajectories over the life course. So this means we perhaps, yeah, this is my last slide, just to go in the direction of an aging 4.0, to combat ageism in terms of balancing social solidarity and individual responsibilities across the life course, to reduce gender and age discrimination, because this is intersecting. We saw this, but this means to offer appropriate life course perspectives for both men and women. We have perhaps develop a new generational contract, not only between, we often talk about this, the old or the young, but there will be several generations, and we have more and more generations living at the same time, so that we will need differentiated generational contracts. We need to acknowledge unpaid reproduction work and develop caring communities. We need to adapt to the technology-induced challenges, also by changing the welfare state as it is now, with more flexible skills development at all ages. And we therefore need to facilitate, and this has would be a first step to facilitate transitions from school to work, from care to work, from work to training at all ages, and therefore also influence demand and supply patterns on the labor market. I hope I was not too long, and thank you very much for your attention.
Thank you very much, Kai. Don't go, because I hope that people will have questions. Please write down notes if anything stimulates your wanting to ask a question. So please, that I do have some, so that we can ask Kai and all the speakers. And thank you so much. Again, the issues of flexibility, of transitions that we can have, as you say, training. I even say even back to school at any age, and interact with others, and even have pensions early in life that can help you. I like that. So we move on. We'll come back. And now I have the pleasure to invite here my neighbor, Dr. Adnike Nova Sigiro from Indonesia. She's a commissioner in the National Commission of Human Rights. Adnike, she's also teaches at the Postgraduate School of Diplomacy, Paramadina University in Jakarta. And she has a long trajectory of work in human rights, also in civil society before, and she has interacted with also a lot with the UN human rights mechanisms. So,
Thank you, Silvia. Distinguished ladies and gentlemen, participants of the conference. This is the best timing to make efforts to keep people awake. The previous presentation was inspiring to me, but I'm sorry for Kai or Mr. Kai. That is something that too good to be true for the context of country like Indonesia. To have a long life learning or integrated life course requires a full security for each individuals, which is not the situation in the context of Indonesia. So my presentation today will tell more about the real situation instead of ways to address it, since addressing ageism will require a comprehensive approach, both institutional and also social or cultural approach. As mentioned in the previous sessions, that ageism stems from oneself, from others, but also from the institutional barriers or institutional culture that take place in one country or in the society. And if we look at the international human rights norm since the beginning in 1948 with the Universal Declaration of Human Rights, the mention of age was not there. But we can understand that as human rights norms and instruments are developing, we see convention on person with disability, recognition towards child rights, women's rights, indigenous peoples, migrants, and so on. And now we understand that we are looking forward to have the mention of age, particularly older person, into the human rights norm at international level and also up to the national or local level. Being a social and structural factors, then my presentation will explain how those areas are situated in the context of Indonesia. Before explaining that, I would explain the demography of older persons in Indonesia currently. In 2019, the National Socio-Economic Survey in Indonesia predicted that people of age above 60 in Indonesia has reached of 25.7 million. So it is 10 times than Singapore, half of population in South Korea. When we talk about population in Indonesia, it's almost reached 10% of the total population. By 2040, it is predicted that the number of older persons or age above 60 will reach to 20. And this is, will grow until about 25% by 2050. I like what the previous speaker explained, how we see life expectancy increase have been seen mostly as problems. It becomes problems because in the context of country like Indonesia, one of the basic issue is about resources, security, especially social security, and also life opportunity since early lifehood, since basic educations, job opportunity, and so on. It is accumulated until the old age. According to one survey by ILAS in 2023, 16.94% of elderly households were recorded as social assistance beneficiaries. It means there are more households are receiving social assistance. And only small proportion of the older persons have financial protection in kind of savings or financial savings. And 60% of the older persons have to live with other family members or other persons who should act as caregivers. And 70% of older persons have been diagnosed with at least one disease. And 30% of the respondents from the older persons have symptoms of cognitive impairment. These situations are an accumulation of the life course barriers that are faced by 280 million of population in Indonesia at the present or at the future as older persons. Interestingly, compared to this situation, the legislation in Indonesia have actually recognized and acknowledged older persons. Compared to the UDHR, our law on human rights in year 1999 have recognized older persons as groups that has the right to receive better treatment and protection in relation to their special needs. And in 1998, before the law on human rights, the law on the welfare of the elderly have already guaranteed 6 rights of older persons. Those are rights in relation to religious or spiritual services, health services, employment and entrepreneurship, education and training, legal aid and protection, and accessible public services. But most of these are on papers. In reality, those legislations are not well articulated into program or policies. And what are the other situations that should be considered in the case of Indonesia? Indonesia, with 280 million of populations, consists of 37 provinces. 37 provinces among more than 13,000 islands. So people live in islands, in remote islands, inaccessible by flight, by bus, or even ships. These are provinces in Indonesia with the highest older person population. From Yogyakarta, Yogyakarta is a famous province for tourists. East Java, Central Java, South Sulawesi, Bali also popular for Indonesia, is known for Bali. North Sulawesi, Lampung, West Java, West Sumatra, Molucas, and South Kalimantan. So we have a different composition of older population in each of the provinces. And that require a different approach in developing policies or program. How ageism affecting human rights especially the older persons in Indonesia. In terms of the right to work, a majority of older persons, is 52.19%, work in agricultural sector, where around 2/3 engage in self-employment and often without formal contracts or access to social security, which limits not only their legal protection, but also their old age benefits. Many of Indonesian, or most of them, most of us, we don't have old age benefits, because in order to have old age benefits, we have to have saving or pension. We have social assistance or cash benefit, but that only applies for older person come from the poor community. If you are older person but you are not coming from the poor community, you are not eligible for old age benefit or cash benefits. Ageism and hiring biases, I think it happens in other countries. Most of employers favor younger workers, and we also do not have same standard for pension age. Some pension is at 60, some are at 58. The highest pension age is for professors. You can get retirement at the age of 70 up to 75. But even though your retirement age is higher, it doesn't guarantee you get better benefit. So that's the situation. And although older persons' rights has been recognized in the legislation, but there is no explicit anti-age discrimination law. So even though recognition is there, but when employer wants to hire someone based on younger age, there is no law enforcement towards those who act like that. Another rights that in the experience of Komnas HAM is the Indonesian National Human Rights Commission, often occurred, is ageism affecting housing rights. As the life course prevent someone to receive opportunities, access, and benefits, for older person, access to housing is also limited because the price of house is way beyond the income of older person. And in situation where communities, individual or groups must be relocated, for example, during redevelopment, South Korea has experience on redevelopment. So when a community is being relocated, relocation often or most of the time doesn't recognize the needs of older persons when they're conducting relocation. And of course, as the result of the lack of economy, income, and so on, many older persons live in poor conditions of housing or homes with other families. Not only themselves, but they have to live in poor condition of housing with other families. Again, interestingly, Indonesia is always good in making legislations. We have quite several legislation which recognize older persons. On the law on national social security system, it already includes old age benefits and pension, but it is only for former workers. It means when Indonesia's economy mostly based on informal sectors, then most of older persons are excluded from the national security. The law on social welfare defines already older person as a target group of social welfare programs such as cash benefits, social assistance, and so on. But the amount of benefits is very piecemeal compared to the needs of one individual or a groups. On the law on housing, there is no recognition towards age specific such as older person. On person with disability, there is recognition towards disabilities, but older person could get benefits as disability if they are identified as disabled. So if we are just being old, we don't get the benefits for person with disability. On health sector or health law is actually where more programs and policies exist. Specific regulations are in place regarding health efforts for the elderly as one of the vulnerable groups. But in practice, for an older person to access health services, they would require the same process as other age. It is something common for Indonesian to access government hospitals. They have to queue since very early in the morning.
1 minute.
Yeah. Okay. And for Komnas HAM, we also receive cases concerning older persons on eviction and land conflicts, denial of access to healthcare and social protection, abuse and neglect in institution or family, and also employment discrimination. So, ageism in Indonesia's political landscape exists as social ageism and structural ageism. On our behavior, others' behavior towards older persons, and structural ageism such as age blind in policies and non-enforceable mechanism. We have some good examples of efforts such as creating National Day of Older Persons. But this National Day is not as famous as other National Day. Like Mother's Day is famous, National Education Day, Child's National Day is famous, but not Older Person Day. Previously, we have National Commission for Older Person, but it was abolished in 2021 by the President. There are examples where local government provide free transport bus card for older persons, but that's only in some cities like Jakarta, who has a lot of fund to provide. As for Komnas HAM, we are still in the way of strengthening our sensitizations and mainstreaming in understanding older persons and also giving a better services for public complaint that come to Komnas HAM. So that would be my presentation. Thank you. Right on time.
That has been there for 2
Oh,
minutes.
Sorry.
Thank you so much, Arnik. Very interesting, but I think that your presentation really exemplifies once again that while there are universal structural issues, the implementation has to take into account the conceptual realities of where you live, and you never should aspire to copy anything that is done in Europe or that intend to do, because not everything that he presented is actually being done in Europe. So thank you very much. And we will go quickly to the next speaker, Dr. Somsak Aksilp. He's coming in online. He's the Executive Director of the ASEAN Center for Active Aging and Innovation. He's a highly accomplished medical professional with extensive experience in public health and health leadership. And he holds a degree from Mahidol University, a Master of Science in Public Health in Developing Countries from the London School of Hygiene and Tropical Medicine, and a diploma from the Thai Board of Preventive Medicine. Dr. Aksilp, the floor is yours.
Thank you, Silvia. Hello, can you hear me?
Yes, we hear you well.
Okay, I will share my slide. Can you see my slide? Yes?
No. No.
No?
We saw a black screen and then it disappeared.
Really?
Is it? Ah, it's still there. Yes, it's there. Sorry. We can see it very well. Thank you. I'm sorry. It's me.
Okay, thank you very much, Silvia. Um, First of all, I would like to thank the organizer for inviting me to share our organization, I can say idea, dream, and the work that we are doing. And I would like to use my heading as from barrier to bridge. I guess our colleague has already listened to many presentations, both pro and con, and we have to admit that both, limitation are there, but also, there are opportunity. Okay, here, many people say there are 5 megatrends that shaping our world now, and one of the very important issue is the demographic trend in our aging world. And you can see ASEAN statistics here. We have all, not only aged, but also aging and pre-aging situation. However, for ASEAN, our aging situation changed rapidly. That's what I would like to mention. You have heard this a lot. I won't go into detail. We do admit that we have this kind of barrier and challenge quite a lot. However, turning barrier to bridge, I think we have done so many things, both globally, as you may see here, and also in ASEAN. Thank you to Ms. Laura that she has already told all of you what ASEAN has already done during the past 20 years for this aging issue, including the ageism issue. So I won't go into detail. They have been doing not only to, using the law, but also try to initiate so many initiatives and innovation to combat ageism, but still a lot of homework to do. So may I summarize that what should health and professional do and try to realize? First, I think we should be aware of the need of the elderly, not the want, because there are so many wants that I think we cannot serve. But if the need, and then we come to, try to analyze carefully, many of the need we can serve, we can properly serve. Even from the second dot, many resource availability already in the community, but we need to mobilize it all together. For example, in Thailand, there are so many funds, support from not only the social welfare, but also from the public health here and there. But there is no one try to jigsaw it together because they work in silo. That's the problem. So it's come into the interdisciplinary mindset. If we can go to more or less talk with the local leader and pursue them, show them where is the resource, and then try to jigsaw it, we still have chance. I will show you later. And here is the regional collaboration AGAC by Center, ASEAN Center for Active Aging and Innovation. You can see from my shirt here that Ms. Lodola has already more or less introduced some that is the ASEAN commitment, ASEAN leader commitment that they know aging era is here and now. So we have to do something. And I have to confess first that my office is quite young. It start running the office in September last year. So it's not 1 year old yet, but we try to do and do things. And we have launched a kind of 5-year strategy goal and plan already. Try to empower ASEAN member states to build resilient, age-friendly society. What we try to do, here is our summary of the 5-year strategy plan. I won't go into detail. It covers not only health, but also social issue, digital, environment, climate, resilience. And I have QR code here. You can go into detail. Again, we emphasize a community and social awareness approach. We try to address the inequality in health and social care. And we try to be a kind of open policy engagement platform. And Ms. Laura has also already mentioned about the ASEAN Active Aging Index. Now we are revisiting and adapting, and that will also track, monitor, and evaluate the ageism indicator as well. Here you can see there are so many players, as I said. So AGAC, we try to act as a kind of connector or catalyst, to connect between a kind of policy and then the implementing agency, the funding agency, connect them together by using our 5-year strategy plan. What have we done and what we are going to do? Now we try to launch a kind of regional plan by strengthening our national focal point from all 10 member ASEAN, 10 ASEAN member countries, to each from one country, one from health and one from social and other sector. They will help us to shape our regional plan. We plan to have 2 training workshops next month in Thailand, and then conclude the regional plan in Japan in October 2025. And we will follow up our regional plan, what have been done in the PMAC 2026. I guess many of you already get familiar with the Prince Mahidol Award conference, which will be held every last week of January. You are welcome to be there. Then we try to launch a kind of age-friendly city as a kind of, pilot area. Firstly, we initiate one province in Rayong to be a kind of model city for age-friendly and smart city solution as well. And we match them with Fukuoka. We try to learn from Japan. Because Fukuoka, there is a project of Project 100 for 100 years old people, and we can learn many things from them. Apart from this, for the digital thing, we are planning to use a kind of, game application to evaluate the health and well-being of the older person. In Thai, here 5 or, sorry, in Thai, but I can translate in English. The first or is food, ahan is food. We have food, we have exercise, we have mood, we have occupation or saving is linked together, the fourth one. And the fifth one is volunteer or social engagement. So you can see this game will get involved with almost all indicators that will be in ASEAN Active Aging Index and try to more or less monitor and evaluate the older person situation from each one, because we plan to have this for, if possible, every older person, first in Thailand, and then we will translate in other language, in ASEAN language, to use in 10 countries. That's what we hope. And then for the advanced evidence base, we try. Now we connect with the NUS, ask them to help us, try to have a kind of meta-analysis of many things. Now we have a kind of happy retirement project with them and HITEP. And for the ASEAN Active Aging, as I informed you already, now we are finalizing this index to be used in 10 countries very soon, maybe starting from coming November in 5 countries first, and then see what is the weakness, what is the strength, what should we adapt. And again, the ageism can be tracked through this index as well. I would like to more or less end with this 2 more slides. That I used to work for the Ministry of Public Health as a Director General of Department of Medical Service. And before COVID, one big hospital in Bangkok, they used telemedicine before COVID. Less than 10,000 cases per year. But during the COVID, as you may already know that they cannot come to the hospital for everyone, for every COVID patient. We launched a kind of home isolation and use telemedicine. During that period, that special period, only 1 year, 20,000 patients use telemedicine. So what I have done during COVID is try to change the concept of hospital-based medical service to be a kind of personal-based medical service anywhere, anytime, if possible. And we have done some already for the medical service. So what I have dreamed is, why not aging service? Why the elderly has to go to the facility, the hospital, to queue very early, to go to the social welfare. Why don't we use a kind of digital disrupted and use kind of people-based anywhere, anytime? That I would like to pursue or to, and if possible, come to dream and work together with us, with Akai. Now we try to do this kind of thing in some of the Thai area. I would like to end with this. I do believe that we can create a world for all age. And in ASEAN Anthem, there is a one sentence: we dare to be and we care to share. I hope you come to dream with us and you share with us the thing for our beloved older person. Thank you very much. ขอบคุณครับ
Thank you very much. Thank you very much. I think I will go straight. I mean, you caused me, I have several questions, and how when you are a very good catalysator, and we can discuss later, but I wanted to ask you how you connect also with the national human rights institutions, for example, and many of the things you do that they are human rights based, but how can we define them as such? And so we will carry on to that, but now I'm very proud to invite two discussants that will analyze or summarize the three presentations that we have. And we have with you today, here with us, Yoo Kyung Park from the National Human Rights Commission of Korea, and online we will have Dr. Silvia Sabo from helpEaji International. So I will call first on Yoo Kyung. She's from the, I said, National Human Rights Commission of Korea. She has a master's degree in human rights and has been 15 years working in the field. And she currently serves as the focal point of the National Human Rights Commission of Korea, and she chairs the Global Alliance of National Human Rights Institutions, GANRI, the Working Group on Aging and the Human Rights of Older Persons. Yoo Kyung, the floor is yours.
Thank you, Silvia, for the introduction. Good afternoon. My apologies to Koreans in the room whom I thought your ears will be free for the receiver for once. I'll speak in English. My apologies. First, I would like to thank the ASEM Global Aging Center for inviting me to be part of this meaningful discussion on ageism. It's a true honor to be here with three amazing speakers for this session. Thank you for sharing your expertise and insights on the critical topic of ageism and inclusive policies for older persons. Your presentations have powerfully shown that while ageism is a significant global challenge, it's not one we have to accept. By combining well-thought-out policies, community innovation, and a focus on human rights, we can build a society that truly works for all ages. So now I'll briefly summarize each presentation before asking each speaker a couple of questions. First, Dr. Laisha-Ling, I hope you could listen to me. Your presentation powerfully challenges the negative stories we often hear on the aging population. It introduces Aging 4.0, a forward-thinking framework for integrated life course models. This model moves away from the old strict structure where education, work, and leisure are limited to certain life stages. Instead, it promotes flexibility, lifelong learning, and removing barriers based on age. This shift not only encourages better connection between generations, but also helps society adapt to fast technological changes. Aging 4.0 also supports smooth transition between paid and unpaid work, education, and family life. It also deals with the inequalities that come from limited access to education and a lack of second or third chances. The framework also stresses the need to value unpaid care work, close gaps between genders, and ensure everyone has equal chance throughout their life. To achieve this, our support system must move beyond strict age-based norms and instead support each person's unique path, balancing support for everyone with individual responsibilities. This approach creates a more welcoming society for all people of all age. So, my first question to you is the lifelong model you describe where activities can happen at the same time. Seems like a huge change in social policy, which is never an easy task. What do you think is the best way to handle these big changes? Or is there a specific area we should focus on first to have a biggest impact? And my second question, I believe that for these reforms to be both socially beneficial and legally enforceable, a human rights approach is essential. How can we best ensure that Aging 4.0 includes the right of older persons, especially the right to equality and non-discrimination, in how we design the policies? Now moving on to Commissioner Sidro's presentation. You looked at the serious issue of ageism in Indonesia, a country where the number of older persons is growing fast, expected to be reach 25% by 2050. Many older Indonesians face financial hardships, often work in informal jobs without access to pensions and social security. It's also hard for them to get enough savings, housing, and healthcare. On top of this, ageism shows up in different ways like bias hiring, forced retirement, and being left out of housing support, which makes life harder for older persons. The situation is actually familiar to me and to many of our audience today here, as it's similar to what happens in Korea as well. What's also similar is your point that while Indonesian law recognizes older people as vulnerable groups, protection are based more on welfare than on rights. This is also the case here, I would say, in many countries around the world, a common problem we all face. You also mentioned that even though government initiative exists, they often don't have clear rules against discrimination or specific duties for those in charge. You're calling for a right-based framework to ensure autonomy and dignity of older persons and provide them with enforceable protection. So Commissioner, my first question to you is, you noted that the language used in policy is based on welfare and lacks enforceable rules or clear duties for those in charge. This is a common challenge for many NHRIs and many faces because a lack of guidance, I think, personally, on how to protect older persons from a human rights perspective. You described many cases that Komnas HAM has handled, such as an eviction, denial of healthcare, abuse, and job discrimination. What measures or approaches have you found to be most effective in dealing with these issues from a human rights perspective? And building on to that, my second question is, how can Indonesia's legal and government framework be strengthened so that older persons can demand their rights through accessible legal options instead of just depending on government welfare? And finally, to Dr. Somsak Aksils, you addressed the fast pace of population aging in ASEAN region, especially in the developing member states. Your older persons in this region often face systematic barriers, including legal protection, economic exclusion, and discrimination in workplace. Access to age-inclusive health and social service is limited, especially in rural areas. You outline both global and regional responses, including the WHO's global campaign to combat ageism and the ASEAN Kuala Lumpur Declaration on Aging. I was especially impressed by the leadership of the ASEAN Center for Active Aging and Innovation, ACAI, although you mentioned it's a very young initiative. You have a 5-year plan focused on community-based solutions and building skills. Its programs include initiatives on age-friendly and smart cities, using game as a digital tool, which I never actually imagined, and evidence-led policies. ACAI's efforts to encourage different groups to work together and for the public to participate are key to moving away from top-down services and creating inclusive, people-centered system for dignified aging. This prompted me to reflect on my own experience in 2022 when I was involved in drafting the National Human Rights Commission of Korea's proposal for a convention on the rights of older persons. One of our biggest challenges was how to change people's mind about aging, especially those who work with older persons. Ensuring older persons' autonomy is one thing, but what is more important is getting people around them to be willing to support and respect that autonomy. Though this is difficult in practice, as changing mindset is always incredibly hard. With this in mind, my first question to you is, as you mentioned in your presentation about capacity development, including awareness raising, in your experience, how can we effectively raise awareness among those around older persons? Could you share any example of successfully changing perception about aging? And my second question is, from a right-based perspective, how can ACAI encourages ASEAN member states to include rights of older persons, such as participation, accessibility, and freedom from discrimination into regional cooperation plans? This would make sure that these values guide not only programs, but also binding policy commitments. And that concludes my remarks. Once again, thank you all for giving me the opportunity to engage with such valuable work from across Asia. It was enlightening to me, and I look forward to our discussion. Thank you very much.
Thank you so much, Yu Kyung, for this very thorough analysis and good questions. I will ask the speakers to think about the responses, but before that, I will call on Silvia Sabo, Global Income Security Advisor of helpage International. She's a social scientist and international development professional with over 15 years of experience in socioeconomic research, project design, and stakeholder management. Before helpage, she also held academic positions at Dongkook University, South Korea, and the Asian Institute of Technology. Silvia.
Thank you very much, Silvia, as well. And I should just clarify that I'm actually switching affiliations this very week. So I'm still presenting here helpage International, but at the same time, I'm also joining ACAI. Very delighted to be working with Dr. Somsak. So and just for clarity, and of course, looking forward also to engaging with all the colleagues in my new role at ACAI. I think Dr. Park kind of did my job already, because this is also what I had prepared in terms of the summary of the three presentations. But nonetheless, I think I try not to be repetitive and just share a few remarks in terms of what has been said. Also from the beginning, I think, of this from the morning, from the Korean morning time, I think we have really heard quite a lot of inspiring ideas and examples, and very, very big thanks to the organizers for this invitation. 초대해 주셔서 감사합니다. 진짜 아주 중요한 일을 계시고 하시고.
Thank you very much for your dedication.
I know in Korea, of course, old age poverty is also a very, very critical issue, and I think here in ASEAN we are also looking forward to learning from some of those experiences, which of course Korea has gone through. So let me just start with giving a few points of a very brief summary. I don't want to repeat what has been just said by Dr. Park, but I think the three presentations really have been very, very complementary and of course very different, providing a very unique perspective, starting from Dr. Kai, if I may, quite a European perspective, and of course giving this very innovative framework on integrated, flexible kind of approach to age, not really splitting our life course through this kind of very rigid time spans, if we wish. But what also struck me, I think it was also mentioned by the colleague from Indonesia, is how different the context is and how different approaches are needed. Because I think when we saw the graph from Europe, I think what struck me when we saw the age, of course, it is the kind of standard thinking. It is also shifting in Europe, but we have seen this last kind of box with leisure for old age. And we know very well, of course, it is very much changing in Europe now, but we know very well that in Asia, in particular in Southeast Asia and in South Asia, informality, of course, is a huge, huge issue. And this is, I think, what has been highlighted also by our speaker from Indonesia. Hence, of course, that the idea of leisure is something which perhaps is not so so common in some contexts. And I think it was also mentioned through the presentation of Dr. Sugiro, really the key issue in terms of old age security, including, of course, income security, this lack of benefits, financial benefits, or pension, if we wish, contributory pension in old age, and the reliance on, of course, very tiny allowances from the government. And we know very well, of course, in those remote areas, it is not so obvious that even those tiny allowances are going to get delivered. Sometimes, of course, there are digital barriers. Older people, they do not have internet access, or perhaps they don't have the necessary digital skills to be able to even receive those tiny payments. So I think the importance of this context is really, really critical. And I think Dr. Sugiro also provided some very specific examples of legislation. And here again, it is fantastic that there is existing legislation in many contexts. I think recently in Vietnam also we have seen some very promising developments. There was in an employment law which has been amended. And I think for the very first time, there is a definition of age discrimination, which has been included in this amended version of the employment law, as well as the mention of reskilling and upskilling of older workers. It is very, very, of course, promising, but we know at the same time, as I think it has been highlighted by our previous speakers, as well as in this session, that there are structural barriers, and of course there are also other societal barriers in many cases, and we know very well also in the case of South Korea. I think it was also presented by Professor Lee in an earlier session, that even though, of course, there are legal measures, there are laws, etc., of course, they are not implemented. Of course, that is very, very worrying. And I think we have heard also from the previous session that an older person is classified as 55 plus. I think when life expectancy is exceeding 80 or is close to 90, and this kind of classification perhaps is not appropriate. And it's very, very worrying, in particular in a situation where the pension, the contributory pension age, the age where we can receive that pension is 65. So, okay, of course, we can ask ourselves where the income is going to come from during this gap. So it is an issue across not only middle-income countries, but also some high-income countries, of course, in terms of our income security in old age. And yes, the retirement age, of course, should be abolished in the sense that it should be, of course, on a voluntary basis. If someone wishes to work longer, I think most would support this idea. But then we all know, of course, that even in high-income countries where legislation is in place, yet, of course, those unspoken prejudices exist. So there is huge amount of work to be done beyond legislation, I think, in terms of this really cultural shift, how we can jointly tackle it, how we can address it. Of course, hopefully, little by little, we'll be able to progress with this agenda. Thirdly, and very critically, I think Dr. Somsak's presentation from ACAI has highlighted some very inspiring and innovative approaches. Of course, collaborative approaches, and of course, the collaboration across the region and the knowledge exchange, which is taking place within ASEAN, and the new evidence-based initiatives, such as the Active Aging Index for the ASEAN region, as well as some other important projects, such as the Happy Retirement Project in Thailand. I think we are very much looking forward to generating and releasing this evidence, but I was also very much inspired by his remarks when he said we should address the needs and not the wants. And I think that is also something which we should be mindful of. I think it's very powerful, as well as the community resources, because I think the kind of prevalent narrative and approach is, especially in the middle income countries, and lower income countries, is that of course there are no resources, it cannot be prioritized. Yet of course the budgetary resources are not the only resources, they are community level resources, and we know very well from our work across different countries that there are very powerful and large scale older people associations, as well as self-help clubs, very often intergenerational self-help clubs, which really act as guardians, providers of income security, as well as long-term care, and also help with the issue of social isolation. So the community level resources are very crucial. I want to perhaps just sum up and touch on one more issue, which I feel did not come very prominently in the sessions, in our session, as well as in other sessions, and that is the one of climate change. Of course, climate change is a global issue. Of course, it's affecting Europe, it's affecting Asia in terms of exposure, even much more. And of course, older people are also very much affected by the impacts of climate change, and they also contribute very much to the climate action. Just recently, I was involved in a study with colleagues from Bangladesh on climate action and the role which older people play in mitigation and adaptation efforts when it comes to climate action in coastal Bangladesh. And it was very clear that they play a very, very big role, including, of course, through their indigenous or traditional knowledge and the skills which they have, including, for example, through shifting agricultural practices, etc. So I don't want to add too many questions. I think there have been already many questions which have been asked, but if there is time, I just want to raise those 2 points. One is on climate action, and the other one is on income security, but more specifically on universal social pension, because I think that did not come across in the session. Universal social pension and ensuring income security for older people in this context of ageism, age discrimination, difficulty accessing workplaces in old age, and very often weak or weakening social protection systems. So thank you very much again to all the speakers for very inspiring remarks, and very much looking forward to engaging with all the speakers. Of course, if you come to Bangkok, also very keen to meet. And again, very big thanks to the organizers. 다시 초대해 주셔서 감사합니다.
Thank you for inviting me today. I look forward to the discussion.
Very, very soon. I, of course, lived in Korea for quite a long time and hope to be there very soon. Thank you very much again to the organizers and the speakers. 감사합니다.
Thank you very much, Silvia. We have some time. Before I ask the speakers to respond to the questions, I was wondering 2 things. First, anybody else who would like to add questions? This is the moment to ask. Please think about it. But the second thing I wonder from the organizers, is it possible to put the 3 speakers online on the screen so we can see them when they answer the questions and we feel like a real panel? Is anybody would like to raise the hand and add a question to the? Yes, please. Can we? Yes, there is a microphone. Somebody is bringing a microphone. Please identify yourself, say your name, and. Yes, yes.
예, 반갑습니다. 저는 인천평화복지연대 상임대표 강주수입니다. 저희 단체는 한반도 평화와 우리 사회의 보편적 복지를 위해 활동하고 있는 시민단체입니다. 그래서 우리 한국 사회가 이미 고령화 사회로 접어들었다 보고
for Korean citizens, and of course there's an issue around poverty of older persons. In order to improve the quality of lives of older persons, we have established the Human Rights Center for older persons, and we are carrying out activities for that. And during the morning session and afternoon session, in the process of making policies for older persons, support from young people is needed, and also to establish intergenerational solidarity. So in that sense, of course, there's a budget constraint and resource constraint. But in making policies for older persons, young persons might oppose to the idea, causing uneasiness between different intergenerations. So in Asia or in Europe, in making policies for older persons, Is there any good example of building solidarity with the young people? Thank you.
I didn't hear all from the beginning, but I think that the question was heard, correct? Thank you. So now, thank you so much to the organizers for allowing all the speakers to be in the screen. And I would like to call on Kai first, if you would like to respond the questions that Yukion posed, and perhaps the gentleman, I didn't hear his name. Thank you, Kai.
Yeah, sorry, I have two problems. First, my connection was interrupted a bit during Dr. Park's comment, and I didn't get any translation from the gentleman who just...
Okay, can you please repeat the question?
So I'll repeat my questions. Of course, yes, I was going to. So, and I also translate the gentleman's remarks as well for you. So my first question was that the lifelong model you describe, where activities can happen at the same time, seems like a huge change in social policy, which is never easy. So what do you think the best way to handle these big changes? Or is there a specific area we should focus on first to have the biggest impact? And can I move on to my second question? Okay.
Yeah.
Okay.
No, this was clear. Yeah.
Sure. Okay. Good.
And the second was, I think that this I got. Well, I think it is, of course, a very European or high-income country perspective from countries with functioning welfare state, but I think nevertheless that this vision of a more integrated life course is of course something that should be taken into account also when constructing, and this is still my hope that globally we are all constructing kind of welfare state, and if we want to combat ageism and to adapt to longevity, which is a global trend, we have seen countries today where you have 10% of people over 60 or 65. We will all be countries with persons above 60, hopefully, with 30% of share of older persons, if we then still call them like this, and therefore this was my idea to present this vision also in this context. The other thing is how to change existing welfare states, which is of course very difficult. But the thing is that currently, and perhaps mainly women who followed my presentation saw, well, actually, this is what I'm already doing. But the thing is, I'm not paid for it, and I'm not acknowledged for this. And actually, I'm facing a pension gap because I'm doing what I'm doing. I know a lot of friends, and also mainly female, who at their 40s started a completely different career, but they paid for their education themselves, and didn't get an acknowledgement for that, and then they faced the children needed care, but also the older parents needed care. So actually, this is then the rush hour of life, and in order to avoid this, we need, and here also we have very different contexts. I'm fully aware, Silvia, also that. If you have societies where there are also lower share of children, or a higher share of children that that are born earlier throughout the life course. This might spread the care work also, but currently the general trend is to have children later, at a later stage of your life, and at the same time you have older parents getting or needing care at an earlier point, and then you are often crushed there.
Thank
and
you,
therefore,
Guy.
yeah,
I just want to have time
I'm
for
aware
the
of these
others.
different contexts, and but I don't want to take too much time. Thank you.
Thank you very much. In fact, I must say that that was my first reaction as well. I said, well, we women know what it's like to do 10 things at the same time. So, and the context thing, I also want to say something. We should never allow culture to block our rights. So we cannot use cultural or local, practices to block somebody for do something they want to do. Okay, so that is a very wider discussion. But Nika, would you like to reply to? Yeah. Thank you.
Yeah.
Yeah, but I want to hear, listen, Nika. Okay, sorry. Yes, do translate the.
Sorry, I just wanted to translate the remark from the gentleman from the floor. So in a nutshell, he mentioned that there is this limited resources and budget, and that might actually cause the conflict between the older persons and younger generation. So he wanted to ask some good examples of intergenerational solidarity.
Thank you. Yes.
Thank you, Sylvia. Thank you for Ms. Park for the difficult question. And I would like to first respond to Ms. Park's question that are very fundamental. If I can answer that fully, I answer the problems. But I will not make such generalization in answering her. For example, what approach or measures I found most effective? I cannot say one is the most effective, but in handling complaints from older persons concerning eviction, healthcare, or abuse, for Komnas HAM, Indonesia Human Rights Commission, we have work methods on human rights mediation. So on cases dispute between individuals, older person, let's say with companies or with governments or other actors, then we conducted mediation. Because justiciability of rights is not take place. It's not there to claim through judicial process. So mediation is one of the methods that Komnas HAM use. Whenever there is a relocation, so Komnas HAM will conduct monitoring and request if both parties would like to take mediation process to find a common agreed commitment in resolving the problem. That's one of the thing, but I would not say it's most effective, because to put two parties to agree to mediation is also difficult. On how to strengthen a legal and institutional framework, I cannot also make generalization for Indonesia, but for Komnas HAM, we develop human rights cities approach, where we develop human rights mainstreaming for local governments. And from my presentation, many initiatives regarding respect towards older persons' rights come from local government. But it is only applicable for local government who have local, local budget, like big city like Jakarta, Jogja, Bali, rich cities or provinces. So they can develop programs for older person. Then in that local government, we could approach them to develop more approaches and perspective on older person rights. But of course, there are other gaps that require legal and institutional strengthening. And following the question or response from the last gentleman, in Yogyakarta, there is one local government project. It calls Say Hello to the Elders. So it's basically bringing up younger generation, students from universities, to visit older persons just to say hi, in order to be familiar with the situation of older persons in those local contexts. I would stop.
Thank you. Thank you so much. We ran out of time, but I don't want to leave Dr. Axel without responding. If you could do, in 1 minute, do you think that you could respond to the question that Yu Kyung asked about how to raise awareness among... Can you share any example of successfully shifting perceptions towards aging? One example, can you?
Oh, you have 5 for other people. You have 1 minute for me. Not fair.
No, I'll give you 2 minutes. That's what Anit got.
Okay, I will try my best. First, I would like to reiterate again that AGAC, we act as a connector. And as I said, we are preparing the workshop for the country coordinator. I would like to answer Ms. Park in this way, that the one who are the owner of the project is the country themselves, is not AGAC. But we will act as I said, connector, catalyze, something like that. And we will try to get all experts. For example, there in Seoul, Tengku Aisan is also one of our experts. That thank you for helping us. I think we try to connect all these experts together, to pursue and convince the country coordinator to go in the way that we want. And then we can more or less, I think we can try to change some of their mindset and not working in a silo health and social issue, but try to integrate this kind of thing, as I said, into a regional plan, and then they will do the thing by themselves. I will not go into all detail. You have 2 minutes. I think I used 1.5 minutes. Thank you.
Thank you. Thank you so much. And my apologies for the organizers who I took more time than we were given. We have to stop here. I will just take the liberty to say thank you so much. And really, let's not forget that we are talking about human rights and needs and rights. And let's not cancel the wants, because I think that the important question is who defines the needs. So autonomy is an important issue, a very important issue, and we have to respect what other persons want as well. So thank you so much for all of your important work and discussion. And next time, see you.
Okay. Well, thank you for all the wonderful panelists and the moderator. So after a full day of meaningful dialogue and learning, we now arrive at the closing session of the 5th ASEM Forum on the Human Rights of Older Persons, Present and Future. Thank you for staying with us throughout the enriching day. And to formally close the forum, Dr. Hae-Kyung Lee, Executive Director of ASEM Global Aging Center, will now deliver her closing remarks. So let's welcome her to the stage one final time. Thank you.
now is the time for us to close our forum. Let me begin by extending my deepest appreciation to all of you, our really fantastic presenters, discussants, and moderators, and the participants who are in both here and online, for your insights and very, very high level of expertise and the energy you have brought to today. I'm deeply, well, maybe I have to skip, but I'm also deeply grateful to our co-organizers, the National Human Rights Commission of Korea and the delegation of the European Union to the Republic of Korea for their steadfast partnership and unwavering support, without which this important gathering would not have been possible. Throughout the day today, under the theme of Unmasking Ageism, Cultural Realities, Systematic Barriers, and the Case for Change, we have shared lived experiences and research findings and explored the ways to measure ageism and discussed the policy ideas and practices to address it across Asia and Europe. These exchanges have deepened our understanding of both roots and structures of ageism and the steps required to dismantle it. What we heard today is quite clear. First, ageism is not just a matter of personal bias. It is deeply entrenched structural problem that limits opportunity, undermines dignity, and perpetuates inequality. It exists not only in the workplaces, but also in healthcare, housing, social and digital services, finances, media, and beyond. And secondly, we were reminded that older persons are far from a homogeneous population group. It varies with the places and every other factors. They are not simply recipient of care and protection, but they are active right holders who want to be seen not as vulnerable but as valuable. Aging itself is not the issue. The real problem lies in the stereotypes, biases, and discriminations that surround it. And overcoming ageism demands more than incremental policy reforms. It requires a paradigm shift, a fundamental shift in our perspective. We must reframe aging as a stage of empowerment and value. And perhaps more important, our gathering and dialogue today reaffirmed that the global war against ageism has already begun. Perhaps it's already well underway. We have confirmed not only the strong initiative of WHO, but also the preparation of the UN Convention on the Rights of Older Persons and various anti-ageist activities of CSOs. I was very much enlightened. I was very much pleased to have this information through this forum, such as Every Age Counts, A World for All Ages, and also a Center to Reframe Aging, hel프에이지 International, and many more. What is needed now is to strengthen the international cooperation. And I'm very confident that the ideas and exchanges and connections first here will continue to strengthen our efforts to fight against ageism. But I was very much impressed by the idea of Aging 4.0 of Kai, which I suggested Kai, which is the other way for the institutional adaptation to the aging society. The institution, at the institutional level, I mean, state regime has to be adjusted to the changing society. The age 4040 is quite meaningful and enlightening to me. And my hope is that the knowledge and commitments shared here will take root in each country, in every country, in shaping policies, inspiring collective actions. Thereby, I think today's gathering can become a meaningful stepstone in advancing the global fight against ageism. Well, before closing, I would like to thank once again everyone who has worked tirelessly, both on stage and also behind the scene, including my staff of AGAC, to make this forum possible. Well, thank you. I look forward to meeting you again at the next forum as we continue our shared journey toward the common goal, a society free from ageism. Thank you very much.
Well, thank you, Dr. Lee. Distinguished guests, this concludes the 5th ASEM Forum on Human Rights of Older Persons, Present and Future. And I think we have taken a vital step toward unmasking ageism and dismantling age-based prejudice and building a truly inclusive communities for all generations. So I hope the insights and commitments shared today will resonate beyond this room and inspire us to move forward. And thank you again for your distinguished presence throughout thoughtful contributions and dedication to this vital cause. I would also like to acknowledge, as Dr. Lee just mentioned, the staff of the ASEM Global Aging Center, the interpreters, and the technical staff for their great teamwork to bring us together online and offline in different time zones today, as you experienced. So thank you, everyone, for all your work. And the 5th ASEM Forum on Human Rights of Older Persons, Present and Future is now finally concluded. Thank you very much. So wish you safe travels, continued success in your important work, and pleasant evening. Thank you very much.